Good afternoon. Today I'm going to give a speech titled Preventing the Next Tragedy: Why Domestic Violence Lethality Assessments Matter. Most people believe domestic violence homicide happens without warning. We often hear about a tragedy on the news and assume there was no way anyone could have known what was about to happen. However, research tells us something very different. In many cases, warning signs are present long before life is lost. The problem is not always that the warning signs don't exist. The problem is that we often fail to recognize the signs, understand the signs, or even act on those signs. I did not simply choose this topic. This topic has become a major part of my life. My experiences with domestic violence loss inspired my advocacy work and ultimately led me back to college to pursue a degree in social work. Domestic violence affects every community, every profession, every demographic group. Whether we realize it or not, most of us know someone who has experienced domestic violence. Today, I will discuss the problem of domestic violence homicide, explain why warning signs are often missed, and describe evidence based solutions that can help prevent future tragedies. Domestic violence homicides are a serious and preventable public safety crisis. According to the Centers for Disease Control and Prevention, millions of Americans experience intimate partner violence every year. Domestic violence affects victims physically, emotionally, psychologically, and financially. Domestic violence affects children, family members, coworkers, and entire communities. Many people imagine homicide as a sudden event that comes out of nowhere, but in reality, countless victims have experienced a pattern of abuse before the homicide occurs. Domestic violence rarely begins with deadly violence. Instead, it often escalates over time. What may begin as controlling behavior can progress to intimidation, threats, isolation, stalking, physical violence, and eventually homicide. One of the most significant risk factors is access to a firearm. According to research from the Johns Hopkins Center for Gun Violence Solutions, the presence of a firearm dramatically increased the risk of intimate partner homicide. A firearm drastically changes the equation. Situations that might otherwise result in injury can become fatal within seconds. Domestic violence involving firearms also places children, family members, responding officers, and bystanders at greater risk. The reality is that domestic violence homicide is not only a family crisis, it is a community crisis and a public safety crisis. So, if warning signs often exist before these tragedies occur, why are they so often overlooked? One reason is that many people do not recognize the signs of high risk violence. Research on the danger assessment developed by Dr. Jacqueline Campbell has identified several warning signs that are strongly associated with increased risk of homicide. These warning signs include stalking, strangulation, threats involving weapons, escalating violence, coercive control, and obsessive jealousy. Unfortunately, many people view these behaviors as relationship problems rather than danger signs. For example, stalking is sometimes dismissed as persistence. Controlling behavior is sometimes mistaken for protectiveness. Repeated threats may be minimized because they have not yet been acted upon. However, research tells us that these behaviors can signal a significantly increased risk of lethal violence. Another reason warning signs are missed is that victims often interact with systems that could potentially help them. Many victims have contact with law enforcement officers, healthcare providers, domestic violence advocates, social workers, friends, family members, clergy, the court system. This They all have contact before the homicide even occurs. So, how do we identify which situations are the most dangerous? Without structured assessment tools, professionals may rely solely on personal judgment. Important risk factors may be overlooked and opportunities for intervention may be missed. Fortunately, there are proven strategies that can help identify danger and improve safety. One of the most effective tools available is a lethality assessment. A lethality assessment is a structured set of questions designed to identify victims who face the greatest risk of serious injury or death. These assessments examine known risk factors such as firearm access, threats to kill, strangulation, stalking behaviors, escalating violence, and other indicators identified through research. Rather than relying on guesswork, lethality assessments provide a standardized method for identifying high risk situations. When victims are identified as being at high risk, they can be connected with safety planning, advocacy services, shelter resources, legal assistance, and other support systems. Research has shown that victims who participate in these programs are more likely to engage in services that increase their safety. In addition to lethality assessments, communities should support evidence based interventions designed to reduce risk. Protective orders can create legal protection for victims when properly enforced. Firearm relinquishment requirements can reduce access to weapons in high danger situations when legally appropriate. Coordinated responses involving law enforcement, courts, healthcare providers, and advocacy organizations can improve communications and intervention efforts. Education is also critical. The more people understand warning signs, the more likely they are to recognize dangerous situations before they become fatal. So, what can each of us do? First, understand warning signs associated with high risk domestic violence situations. Second, share domestic violence resources with friends, family members, coworkers, and community organizations. Third, support local domestic violence agencies and victim service programs that provide assistance to survivors. And finally, encourage our community leaders and policy makers to support evidence based practices that help prevent domestic violence homicides. Domestic violence is not just a personal issue, it is a public safety issue, it is a social justice issue. Every one of us can make a difference. Together, we are stronger. Warning signs often exist before these tragedies occur, but they are too often missed or misunderstood. I have personally witnessed what happens when warning signs are ignored. I've seen what happens when the systems fail to protect families, and I believe that things must change. We need stronger protection for victims of domestic violence. We need better accountability. We need laws that prevent repeat violence before it becomes a tragedy. Evidence based interventions, such as lethality assessments, protective orders, coordinated community responses, and public education, can help identify danger and improve safety. We cannot change the tragedies that have already happened, but we can learn from them. By recognizing warning signs, supporting evidence based interventions, and taking action in our own communities, we can help prevent future tragedies and save lives. Thank you.